Shoulder issues. So many of us have shoulder issues as we get older. It's hard for us to do things overhead. We feel stiff. We get pain in these certain range of motion. What is going on? What can we do about shoulder tendonitis, shoulder impingement, shoulder bursitis? Well, we're pretty much talking all about the same type of thing here when we talk about those three conditions. And we got Bo Bones here to help demonstrate, baby. How you doing? You can at least see part of them. So if you look here at your arm bone, right, you have a bunch of muscles attached to the greater tuberosity out here that are in the rotator cuff, okay? And the rotator cuff is responsible for moving our arm like this or muscles like this, or pulling it in and things of that nature. And what happens is a lot of people, they have pain in their shoulder because this space here, if you can see from the back, as we have the clavicle here, we have the shoulder blade here. When we get through here, there are muscles that have tendons like the supraspinatus that starts here and it travels this way, and the tendon goes right under here, and then you have the bursa on top of that, and so on, right? And so that can be really compressed, that space, and that's just one of the rotator cuff muscles. There are obviously four of them, but if we can open this space up, that seems like a good thing, right? And a lot of people say, oh, we go right to surgery. What are they going to do in surgery? Well, typically arthroscopic surgery, and this is our last option, right? But they'll shave this part of the bone down, the acromion process here, and what they'll try to do is open up this space, right? But that's typically unnecessary. So if you have shoulder pain, again, that should be your last resort. And let's talk about how to fix it, right? Permanently. So if you can reduce this compression of space, right, that's a good thing. The tendon gets all inflamed, it's compressed, and we have our arm bone sitting in like this, right? The head of the humerus. And so if it's internally rotated, right, and on me, that would look like this, right? My arm is internally rotated. I'm compressing all this space because, as you can see, when this arm bone's like that, it's just really tight up in here. So we want to open it up and bring that space larger right there. We want to bring it down and open up that space. So what we want to do is we want to help our arm move in all the directions that is going to open up that space, right? In simple, whether it's bursitis or tendonitis. Now, if you had a rotator cuff tear from injury or overuse over time, right, it's important at first to rest it and then to start strengthening the muscles that are going to help to support the shoulder joint. So let's go from very basic all the way up to more advanced exercise. And this is where you can start. So if you just kind of started to have your shoulder pain, this video is not intended to treat, diagnose, cure, prevent any disease. You go see a doctor. All right, disclaimer. So if you want to just open up that space, right, in simple, before even getting into exercises, we can do pendulums. And these are great where, you have your arm here and it's going to help to just get some motion in that joint. And you'll notice I'm not going crazy. I'm not even moving my arm here. Really, I'm just moving my hips, right? And my hips are moving my arm. We can go back and forth this way, side to side. You can stagger your feet. You can go front to back, right? All things of that nature to help just kind of get some mobility in there, right? Now, very basic exercises that we've talked about before here, but we'll reiterate, are something like a shrug. You could be seated or standing, and you're just going straight up and down, right? Working the upper traps there, straight up and down. You can do scap retractions where you bring the shoulder blades down and back, shoulder blades down and back, right? So you bring them down and back and squeezing your shoulder blades together. You tough guys, stick your chest out, right? You bring your shoulder blades down and back, and you should feel some squeezing up between the shoulder blades there, right? That's going to help to pull them this way and to externally rotate you to reduce the pressure coming like this, right? And so those are two really basic ones. Then we can get involved with the band in terms of exercises for different rotator cuff muscles, and one of them would be taking it and lifting straight up. Now, what do we say? We said we want that arm to come like this, right? But we don't necessarily want you to never do adduction or bringing the arm in exercises in life, you're going to do that all the time, right? So it's important to make sure that the joint is just well supported and strong so that that same motion doesn't aggravate you, and so you're not hyper dominant in the muscles that are pulling you like this, like the pecs, right? And so we're going to work the things that are on the side and the back of the shoulder and the top and so on. So the reason we said that is because we're going to start this in external rotation. You're going to open up your hand and give a thumbs up, right? So now we got a thumbs up. And you're going to step on this band. I'll step back so you can see. I'm stepping on it, right? So it's nice and sturdy. Make sure you have, a good base there. That's not going to fly up and hit you in the face. Keep your arm as straight as you can. And you're going to come up to 90 degrees and then back down. Come up to 90 degrees, back down. See if you can do 3 sets of 10 of this. As far as the pendulum and the other kind of stuff, if it doesn't aggravate you or cause sharp pain, feel free to do more. But, 3 sets of 10 should be pretty decent and should suffice in the beginning. The next one is we're going to bring the arm up to the side. We're going to work abduction or abduction. And again, I have that thumb up. I'm coming up to the side, keeping my arm as straight as possible, and back down. You can even do this at a 3/4 angle, side/forward, that's fine. But let's make sure that thumb's up, and let's challenge ourselves a little bit, right? Now, if you have any sharp pain, you're not going overhead here, right? Typically, overhead movements are what aggravate people that have tendonitis or bursitis or impingement or whatever's going on in the shoulder where that space is just compressed, right? So, as far as more advanced exercises go, we got a band here that we tied to the doorknob on the other side of the door, right? And then we shut the door, and so it's a very easy way to stabilize this, right? This thing's not going anywhere. So what you're going to do here is work on external rotation, okay? So we've showed this before at One Wellness, where you just keep your elbow pinned. You don't want to do it like this, right? There's another exercise like that, I'll show you. But keep the elbow pinned and just rotate out. My thumb is up, right? Giving a thumbs up. We're staying in external rotation here. And we're coming out. Keeping that elbow close to my body as I can. If you want to hold a towel or a water bottle or something right here to make sure you don't come out like that, you could do that, right? Next step is, so first off, what would make that easier or harder? It would be harder if I was all the way out here. There's a lot of tension on the band trying to do it. So start nice and close, okay? And you can take it and get an isometric contraction as well, where you hold it here and you step out. Then you step back in, keeping your arm there. Step back out. Step back in, right? Then you can do it when you get more advanced, where you step out, externally rotate, slow on the way back. Okay, so we can do that. You could also do internal rotation, right? But this is more that's for strengthening rotator cuff in general. This is more for people that have aggravation in the shoulder joint. It hurts with overhead stuff. There's impingement, this and that. So I'm not really going to show you any internal rotation stuff for the most part here. All right, we're going to focus on that external rotation because that's a motion that a lot of us have a difficult time doing, right? And so we're going to take the arm here. We're going to externally rotate. We're going to, with the elbow close to the body, we're going to abduct. Then we're going to bring the arm back here, and you're basically, now my thumb is pointing back, right? I'm basically flexing my bicep, bent at about 90 degrees here. Don't let it just cave in like this, like that. And then you come up and out, and I want you to put your palm up towards the ceiling. Then come back in slow. Back to the other position. And then back in. And then back. All right, so that's a multi-step one. You're coming out, abducting, bringing the arm back, coming up and out, coming here. My shoulders are already getting tired. Come here, and then back in, and then slow on the way back. And relax. And the last one we got for you is we're actually going to start in that relatively aggravated motion like this. Okay, but I'm pretty loose on the band here. I'm not all the way out and taut where it's really yanking on me. And I would recommend trying this one really last, and the one that I just showed you last. I tried to progress in order here, kind of difficulty and what your shoulder joint may be able to handle in terms of your rehabilitation. And even if you don't have a rotator cuff tear, you don't have impingement or tendonitis or bursitis, these things are great to do in a prophylactic or preventative sense, preventing you from getting injured in the future, right? So I do this kind of stuff all the time. It's absolutely just great for the shoulder joint. All right, so the last one is like you're pulling a sword out of your pocket here. So what you're gonna do is, your arm's pretty straight, you're gonna pull up. As you pull up and away, your thumb is pointing back and up. Come back slow, right? Slow, 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 slow. And then do it again. All right, so see if you can do 3 sets of 10 of each of these, say 3 days a week to start. And again, if you get any sort of sharp pain, if it really aggravates you, listen to your body, common sense, stop doing it, right? But if it's a type of pain where it's just hard for you to do and your muscles are getting sore, that's a good thing, and you could fight through that type of pain. But again, if it's sharp, it says don't do that, don't you do that. And start with the very basic exercises that we showed you in the beginning and work your way up. Who do we got on here? Say what's up to the people. Yes, those strengthen your shoulders, yes. Yeah, this is all for, tendonitis, bursitis, impingement, rotator cuff. Bull City, I'm Nova. Steve, what's up, Juan? Sabia. We got good vocals up in here. We got the echo. How you doing? The H. How you doing, Sister Real Estate? Appreciate you. Ash. What's up, beautiful girl? Tommy Reed. As for now, we got to go do some work, so you know what that means. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing rest of your day. Thank you very much, and happy When Wellness. See ya.